Uh, yes, so Vex Girl is there. Thank you, Anne, for joining us. And let's see. Here we go. Waiting for team. Here she is.
All right.
Hey! So yeah, people, thank you for joining us again. We had a little technical difficulties because the plumber only knows all of these other things. Hey, thanks for coming back. So everyone, I'll introduce you. This is Denise Wunderler. She is a doctor. Her husband is a doctor, an ER doctor. That is really, thank you. Tell him, I told him thank you when I spoke to him, but could you tell him thank you from the community of trades? We appreciate him for all that he's doing, and his friends and his colleagues. So I want you to share a little bit about what a day in a life has been for you, and having your husband go out every day and work, and what precautions you had to take, with him coming home every day.
Right. Thank you. So yeah, great. Wonderful to see you again, Judy. So thank you so much for having me.
Thanks for coming on. No, thank you.
My pleasure. Glad this worked. This is fantastic. So yeah, so as for every family, it's been very challenging. I think for a healthcare worker family, there's definitely another level of risk, and definitely another level of stress,
Yeah.
My husband did get sick, and I'll get to that in a minute with COVID, and he was just released from the hospital a week ago. But prior to that, so, when everything was starting to heat up, this was now middle of March or so, I actually had him stay. Thank God we have an extra bedroom in our rental house. So he actually stayed in our extra room, because I said, look, you're bringing this home. We can't get sick. If I get sick and go down, forget it. The household goes down. We have our 2 kids here on earth, 1 in heaven, as you know, Judy. And so whenever he would go to work, he'd come home, he would keep his shoes in the garage, take his scrubs off immediately, throw them in the washer, go to his little COVID cave, as we then called it. He'd wash his clothes on hot. And then, if he was sleeping, whatever, then, we're really great team where, we kind of like do the next step for each other without even asking, so then I see, okay, the wash is done, throw in the dryer, and then he would handle it from there. But he would shower immediately after getting home from work.
Yeah, I do that every day when I get home. Almost the same exact routine.
Yes, good job. Yeah, you definitely should do that. So now that was about a week before he actually started to develop symptoms. So he developed and we were talking about this, and he thought fever was the first symptom when he texted me at like that Tuesday morning, I think it was like March 24th or so at 4 o'clock in the morning, that he had a fever. I'm like, oh my gosh, it's not what we wanted. But actually the previous day he had fatigue, and usually as an ER doc doing all crazy, time shifts, they already have some level of fatigue, but this was more than usual for him, and then the fever started. And so for those good 12 days or so, his symptoms were just getting worse and worse and worse, despite what vitamins, whatever we were giving him. We had nebulized treatment left over from my daughter Vienna when she was here on Earth. So even though it was expired, we still used it. We didn't have anything else, so we did everything that we possibly could do.
So I just want to stop you for a second. People listen to this. He did all of those things, right? You said, wear the mask at work. He did all those things. And listen, people, he still got sick.
Yeah.
Continue.
Yeah. He did it. Yeah. Good point, Judy. Yeah. And also want to mention too, back then, we didn't know how severe a virus this was, how severe a disease process this would be. So back in middle of March, people thought, oh, he had a mask on, and he wears glasses, so we already had, eye protection. Low level, a gown and gloves, right?
Okay.
So at that point, that seemed to be fine. But then as the days were going by, there's, oh my gosh, it's more of a serious and virulent virus than what we thought before. That's when they started doing more of the space suits, Judy.
Wow.
And it's crazy. So I know I'm kind of jumping around a little bit, but
no, you're right, because I work in NYCHA in public housing, and maybe I should be wearing those things when I go into the apartment. I wear the mask and the glasses and the gloves, but like you're saying, that might be an important thing. Wow.
It's definitely a very challenging situation, you know, because here, especially in the hospital, you have to automatically assume every person has COVID until they don't. You know, assume it. Automatically assume it. If anyone has any symptoms, you assume it immediately. And of course, those are usually the people who are in the hospital. But what's crazy is that people can have no symptoms and still have the virus and still pass it on.
Okay.
Which is why it's so important, you know, the social distancing everybody is talking about, wearing some type of a mask, washing your hands a lot if you can, you know.
You were talking about earlier a video that you have about washing your hands, and you were talking about some important things that I didn't even. Could you just share that a little bit about washing your hands?
Yes, absolutely. Thanks, Judy. So I saw this video, and I will find it again, I promise, and I will send it to you.
And you can find her at Team Vienna on Instagram, and
Yeah, Team Vienna for SUDC Awareness, the number 4 on Instagram, and just Denise Wunderler, my name on Facebook. I do a lot of stuff on Facebook too. But so this video is it's somebody with gloves on, and they're using blue soap. And so initially they wash their hands as we all do, nothing crazy, not like a surgeon and scrubbing and all that stuff, but just like a regular hand washing, and how we miss a lot of areas of our hands with our regular, just run-of-the-mill hand washing pre-pandemic, you know, kind of mindset. So what was interesting is that put the soap on, the blue soap, important to get what we say, you know, like between the digits. So these spaces here. Okay. And then also tops of the hands. Okay. For sure. Also your thumbs. People never think about your thumbs. When you do a regular washing, you miss the thumbs. And so you definitely want to make sure you get that too. So you're really, really doing the whole entire hand. Both hands. You know, so, but yeah, I promise I will find that video again. And because I want to show my kids too, because of course a picture is worth a million words versus just talking about it, you know?
Yes.
But yeah, but we felt that we kind of took all the precautions that we knew of at the time, you know, and with this, you know, progressing every day, it's a whole nother world. And I think we may have talked about before, Judy, again, how, you know, physicians are also learning about this every single day. This is not a disease process where we can say if you do A, B is going to happen. You do C, D is going to happen.
You just don't know, huh?
We don't know. I mean, there are a lot of different medications out there that what we call they're getting repurposed. That's kind of like a new word, I guess, in the world of medicine, where, you know, we're taking drugs from other ailments, other known illnesses, and using these known drugs for this new COVID-19. Trying to make sense of, okay, if we use this drug, this is probably how it would work. This is how it could help. So it's a scary time in medicine, you know. I mean, thank goodness, you know, there are some people who are, you know, surviving after this COVID, but gosh, unfortunately, as you know, Judy, I mean, we have friends who haven't.
Yeah.
Who are healthy.
Friends and coworkers.
Exactly. Right. Exactly. So, but it's just so important to take all these different precautions.
Thank you for sharing. Before we go, because I know I took everybody's time on this Sunday, I want you to tell us a little bit about Team Vienna for SIDS Awareness, your nonprofit that you have. Could you just share a little bit about why you started a nonprofit and you know, what is your mission, and help us understand the tragedy that brought about this in your life, if you mind sharing. I always ask.
No problem. And Judy, as you know, I'm an open book. Please ask me anything. So thank you for opening this opportunity. So yes, sadly, our little daughter, Vienna, she was almost 3 years old. She was 2.8 years old. And 2.5 years ago, she fell asleep watching TV with her older brother and sister and stopped breathing. And she never woke up. And we have no explanation as to why this happens. And of course, as my husband and I are both physicians, we're shocked that we had never heard of this, called SUDC, Sudden Unexplained Death in Childhood. So as we learned, you know, this is a category of death in kids 1 to 18 years old. So yes, it goes up to the teenage years, which is crazy. Not SIDS. SIDS are the babies 0 to 1 year old. SUDC, is 1 year old to 18 years old. Well, after a thorough investigation, including autopsy, medical record review, destiny investigation, there's no explanation still for these kids. And Vienna is in a research study as well, and even her genetics and everything else that the researchers did still no answer 2.5
No
years.
answer.
And that's the case for many, many families across the world. And even the medical community doesn't know about this. So that's why, you know, I founded our family's nonprofit. It's called, I wore a shirt, of course, Team Vienna. See, there it is.
Oh, nice, nice.
Team Vienna for SUDC Awareness. Because number one, people need to know about this to make a change.
Nice.
You know, so we're doing all various types of events, you know, whether it's a walk or joining other people's races or walks. I'm giving medical lectures in hospitals. I was just at Princeton before the close down occurred, Princeton Medical Center, and different medical schools, and just, you know, trying to increase the awareness and education, because we're not learning this in medical school. We're not learning this in residency.
Right.
We're not even learning about this in our continuing medical education, which is like conferences, you know, that we have to go to, you know, every year, every couple of years. So that's why, you know, we want to make a difference, because the more people know about this, there will be funding for research, of which there's very little research on this, sadly.
Right.
So then we want to prevent other kids from dying and prevent other families from going through this horrible tragedy that is something that you never get over. It stays with you forever, you know. So that's why we're doing this. And our website is teamviennasudc.org. And then also another mom and I had we co-founded the SUDC Coalition, and that's SUDCcoalition.com. And that's we just started this really like a month or two ago, where it's going to be a conglomeration of different nonprofits, individuals, researchers, physicians, anybody, moms, dads, kids, you know, anybody in the world any world citizen. And I got that from you, Judy. I love that, world citizen.
Yeah.
I steal that from you if that's okay.
That's all right.
But anybody who wants to help this cause, because we all know kids, if it doesn't affect you now, or it hasn't affected me, but it hasn't affected somebody now, it eventually will, sadly and tragically, whether it's a friend of a friend, cousins, you know. So I think this is an important, you know, thing to tackle. Obviously, now the pandemic is first and foremost, but once this is kind of damper down and things are under control, then it's going to get with our other.
Yeah, somebody asked a question. It said about the COVID. It said, so people are wrong when they said that it looks just like the flu. Is that correct? Or you want to?
Yeah. So the initial symptoms can definitely look like the flu. You know, just feeling overrun, fatigued, fever. You know, but the difference with this is that, you know, we know about the flu, right? Doctors and nurses don't have to be potentially hospitalized and on a ventilator after treating flu patients. Okay. I mean, so I mean, I'd like to really make like the biggest impact in a sentence. I think, you know, I was trying to think about this. I think that's probably one of them, where, you know, if you think about it, when doctors go to see flu patients, we're not all gowned and gloved and, you know, spacesuit, all this craziness, right? And guess what? You don't really get sick, or maybe, you know, but yet you're not like this. Not like this. Not like this. So that's what this is, a whole nother virus, whole nother bug, and that we don't know enough about, which is why every day, you know, we're trying new medications, and certain medications, higher level medications are running out, you know. So then they're saying, well, this is only for research study purposes, and, you know, so yeah, it's a crazy world when it comes to this. And what's a fear for me is that, you know, here we have the hot spots. It was Washington, California, now New York. Obviously, New York is now number one. Jersey. But how, you know, unfortunately, I see some people who I know, some of my friends even, in other parts of the country where it hasn't really hit. I don't know. I'm not an epidemiologist to know like how it's really going to hit. Right. If it does at all, you know, but I think it's going to hit everywhere, you know, to some level. Yeah. But I think. You said it, some people, so in other states you're saying that some people their epidemic is not as bad as it in New York. So are those people in those states and being so relaxed that could cause it to like go on further, you think? Absolutely. Absolutely. Yes. Absolutely. And it's scary. this is something where we know that I think as of this point, every single state had at least one case. I don't follow all the news every single day.
Yeah, I was, and it was really hard for my soul. I was just feeding my soul that every day, that I took a break this week, not to like be in that space, and because it was just getting overwhelming just to hear all the stats and the people. It's just a lot. So I like you. It's almost so in every state, as far as the last time you remembered one person.
I think every single state has been affected at this point, because at one point there were some Western states that were not affected yet, but I believe every single state has at least one case, obviously more than just the one, but it is represented. So it's everywhere.
Yeah.
So I think of people in other places where they're not truly affected just yet. They're not like us. They're not seeing friends on the ventilator. They're not, seeing the deaths. I mean, a friend of mine's, her sister just died last week. She's a doctor on the front lines, and she died after being on the ventilator for 3 weeks. And this is happening, and it's like, just gives me goosebumps now just thinking about that, how, these people are close to us. They're right here. And this could be anybody's brother or sister or mom or dad or child, you know?
It's unprecedented. Like, I'm just like, people have these myths. Oh, it's going to get warm and it's going to go away. I have people, I'm from Trinidad and Tobago. It's really warm there and really hot. Okay. And they have, the last time I had checked, it was 89. And I think it was over 5 people had passed away. So the warm, people are like waiting for it to get warm, thinking that it's going to help. And as far as you saying, and what I'm thinking, it's not.
Yeah, I think that's probably not the right way to think about this. I think it was just yesterday. I actually did see a little bit of a news report. Like you said, me too. I try not to watch too much of that because of differing information. But just the fact of the warm weather and how it's not proven. And that's another thing too, that when people say things, whoever that is,
right.
or news agency, they make a statement, it doesn't mean that it's fact and that it's been proven. Okay. Maybe it's a hypothesis. Maybe it's something that they think is true, but is not proven. So I think that's probably where maybe a lot of the misinformation comes, when I say, oh, this is fact, and then really it's just, well, they think. It's different. Whether, oh, we think it's the case, or versus, this is the case.
No.
Proven.
Okay, so so I like that, because just like you just said earlier, a lot of doctors don't even know, because as time goes by, your community is figuring it out. So we who don't have those degrees, I only have a degree in plumbing. Hello, that's the extent of what I know. So I don't want to take everybody rest of their Sunday away from them, and I just want to say, listen, if you see a tradesperson walking down the street and they looking filthy and you think that you want to judge them, or the homeless person or whatever, you don't do that. Don't do that. This is not the time. This is a time for us to be alone together, in a sense, so that when we come back with each other in community, we are better with each other. We treat each other better. And like Andrea and I wanted to do this because sometimes people don't know how it is to be on the other, or to be deemed this person essential, and we go into work, and how we feel. Like your husband, you said earlier that some people miss that you didn't get to hug him for the kids for a month.
Right.
And he's doing this and being away from his family because, listen, he signed up to be a doctor. I signed up to be a plumber and to be a New York City worker and help the city of New York and the people in NYCHA that needs help. And I love my job and I love helping people. But if you don't have to be out there, please stay home so that they can go home to their families and we can have this healed sooner, and I can put my shorts on and take a plane ride to Trinidad and get some warmth and some doubles and and all the amazing food that I get fat on when I go to Trinidad. But so that we can go home. Like, we want to go home. They want to go home. She misses the children. Probably the video you saw, the doctor comes home and he can't even like touch his, and you have to live that every day. Your family lives that. So thank you again for giving up your husband and sharing him with us, and to the people all over the world, we really want us. I consider myself a world citizen, and then Trini to the bone next, and American. I love this country of all the things I'm able to accomplish. But if you're out there, stay home, wash your hands, and just remember this: don't worry about a thing, because every little thing, it's gonna be all right. It's gonna be all right. We'll get through this. So till next time. So I stepped out of my comfort zone and I did something I never do. I did a video. My friends who I apologize for all of those years you try to FaceTime me and I hit decline. Don't worry about a thing. We're gonna make it. We're gonna make it, because as humans, there's a lot of us that are really genuinely believe in good energy, and if we keep putting that out there, Mother Earth is going to hear it and see that we are ready to make all the necessary changes to keep this planet beautiful and the way it's going. Right. So thank you so much for joining us with a cup of Jane. Yes, I see my cup as a cup. Let's see yours. Where is your cup?
I don't have one.
You don't have one, but thank you so much. And Vex Girl, thank you for joining us. Thank you everyone for taking time out, and all those who are doing work out there to help our community heal. We thank you. We thank you, and see you soon. Any last words before we go?
So I also want to thank you, Judy, and Ann, and everybody else out there who also who are essential workers, for doing everything that you do. Try to stay safe, stay healthy, and also I love what you both were talking about before, where you're talking about. I think someone asked about if it was too late to start, a trade, or too late to start. And I typed in there, I said, it's never too late to start any career.
Yeah.
And I mean, I went back to medical school at age 27. There were people.
What?
There are people. There were people in my medical school class, where they were nurses for 20 years, went back to school. I have a friend, get this, okay? He was a truck driver for 20 years, because why? Life happens, right?
Right.
He got married. He had kids. I think he's going to go to medical school with like no money and a ton of loans that are going to build up. No. So he did what he needed to do to take care of his family. Right. He was a truck driver for all those years, and then said, look, okay, now kids are all good to go. I'm going to tackle this career I wanted to tackle. So he went to he was in my class. So, and it's incredible. I mean, there's so many people from my class I'm so proud of, because they didn't do the traditional path. So that's why when you mentioned that, you and Ann, I said, oh my gosh, that couldn't be, that's so right on and so perfect, where no matter how old, young, whatever you are, you've already done 3 other careers. If you really want to, be a tradesperson, you really want to be a doctor, you really want to do whatever that is, be a park ranger. I always tell my husband I want to be a park ranger too. But you're never too old to do any of that. I also hear about, I'm sorry, I'm rambling, but I also hear about, people who are in their 60s, never earned their bachelor's degree because of life. Things happen, right? And they went back to get it. People coming back to school to get a higher, even a PhD. Yeah. So it's never ever too late.
Never too late. Never too late. Because
so everybody do it.
You're right about that, because the thing is, the universe, I really believe this, it sends all of us down here to do something. And we are miserable, unhappy when we don't find that thing that we love, whether it be social justice work, being a doctor, being a lawyer, starting a rescue for animals, any of those things. Like, once you start doing it, you come alive. You come alive. So today the challenge is, we leave you with washing your hands, flattening the curve, and staying at home. But what I want you to do after all of this is, during this process, use this time to evaluate what's going on in your life and figure out what it is that drives you, what it is that makes you happy. It's never, ever, ever too late to start. Today is that day. That's right. 5, 4, 3, 2, 1. Get up and get shit done. All right. Bye-bye.
That's right. Thanks, Judy. Thanks, everybody. Have a good day. Stay
Bye.
safe.
Everyone, have a good day. Bye.
Thank you.